So, hello everyone. We are going to report the administering vaginal medication. Let's read.
So the first step in administering vaginal medication is check accuracy and completeness of each MAR or computer printout with healthcare provider. Written medication order, recopied or reprinted any portion of MAR that was difficult to read. So, syempre, need nato ni ensure tag medication list if tama imo og nagamatch imo sa doctor's order. If unclear siya or hindi mabasa something hay, syempre hindi kita mag-proceed it basta-basta. Need gid naton i-clarify anay bago kita mag-proceed. Next, reviewed pertinent information related to medication including action, indication, purpose, normal dose and route, side effects, time of onset and peak of action and nursing implications. So we need to know or at least understand the drug's purpose, ag andang effect, ag syempre dosage ag kung paano imaw mas maging effective. Need gid naton sa urine kung gaano kaabo ag kung gaano imaw kabuhay bago mag-effect. So in this step is syempre, we need to check if the patient hay may allergy or mga past reactions sa medication. Kasi if may allergy is may ginabutang or ginaprovide kita nga allergy bracelet. Assess patient's family caregiver's health literacy. Next, ask patient to describe history of allergies, and next is ask patient any signs of pruritus, burning, or discomfort. So, i-ensure natin niya nagubdan ko atong patient atong mga nawinakag. If hindi na magubdan ro mga medical term, ay syempre i-explain natin in simple terms nga mas ma-understand it atong patient. And dayang step matay, syempre we need to ask our patient ag ipa-describe kanda ro mga allergies nga naga-occur kanda or kung mauno andang allergy if gatake sanda it buong or mga substance. And syempre, the next step hay, we need to ask our patient man if they have any itching, burning, or mga discomfort before giving the medication. In this step is, syempre, we must clean our hands, wear gloves, and carefully nga i-check the vaginal area it patient for any abnormalities like mga redness or swelling. After that nga ma-check, syempre we must remove atong gloves and perform hand hygiene or hand washing again. Next is gina-assess natin the physical ability it atong patient, gina-ensure natin niya makahugag or makaposition andang sarili properly para sa procedure. If hindi nanda kaya, hay buligan natin syempre and i-assist natin sanda. And next is we must check the knowledge it patient, i-ask natin sanda if may hayus yun sanda nga medication sa vaginal before, ag ipa-explain kanda if ano andang gina-expect. Next is we must discuss the purpose it medication action ag possible side effect, and of course we must allow our patient to ask any questions. Prepare medication safely. Of course, we need to wash our hands and use proper techniques to prevent contamination while gina-prepare the medication. So, in order nga mas ma-ensure natin, hay i-check natin ito yung beses yung medication label. Next is give medication on time. We nga mga nurse must ensure the medication is given at the right time sa tamang oras kit and follow the 12 rights of medication administration. And next is confirm patient identity. I-verify natin yung patient identity using at least 2 methods like asking the name or birth date. Next step is double check natin before giving the medication. So bago natin itaarang medication, hay i-compare anay natin sa MAR or the medical administration record for last and confirm if the patient hay may any allergies. We must ensure the privacy and comfort. So syempre gina-close natin kararo mga curtain or door and provide it mga necessary supplies, and syempre buligan natin yung patient sa anang pinaka-comfortable nga position. Next is drape lower body para makip ag maintain your comfortable it patient, especially ra privacy, so need natin i-cover anang lower body. And also ensure good lighting, make sure the area hay well lit so mas ma-apply the medication accurately and safely. Perform hand hygiene and applied gloves. Inserted vaginal suppository. So preparing the suppository is take the suppository out of its wrapper and then apply good amount of water-based lubricant to the rounded end and make sure nga the suppository is at room temperature, and then lubricate the index finger of your dominant or the stronger hand. Positioning the patient. Use your non-dominant or weaker and to gently separate the vaginal folds from front to back. So daya is nagahelp imo para mag-operate sa datong area para sa easier insertion. Next is inserting the suppository. Using our dominant hand, insert the rounded end of the suppository into the vagina. Next is i-push along the back wall its vaginal canal as far as your finger can reach. Next is the cleaning up, which is i-remove dayon ro finger ag wipe away ro mga leftover nga lubricant around the vaginal opening using a tissue or a cloth.
Today, I will be discussing the proper procedure for applying vaginal cream or foam. Fill cream or foam applicator following package direction. Read the package direction carefully and put the right amount of cream or foam into the applicator para ma-ensure the tamang dosage at medication nga nagamit ag para ma-prevent ang underuse or overuse. With non-dominant glove hand, gently separate labia folds. With your less used hands, left if you're right-handed or right if you're left-handed, gently open the outer skin folds of the vaginal area. Daya is nakakabulig mag-create a clear path para sa pag-insert at medication properly without causing discomfort. With dominant glove hand, gently inserted applicator approximately 5 to 7.5 cm or 2 to 3 inches. Push applicator plunger to deposit medication in vagina. Hold the applicator firmly and insert it carefully into the vagina to the recommended depth. Then press the plunger to release the cream or foam. So proper placement ensures na ang medication is naabot ang intended area for effective treatment. Withdraw applicator and place on paper towel. Wipe off residual cream from labia or vaginal orifice with tissue or cloth. Slowly take out the applicator, wipe any extra medication from the skin, and place the used applicator in a clean paper towel. Panatilihon naton nga malimpyo ro aton nga area para ma-prevent ang irritation and makabulig ma-maintain ang hygiene after applying the medication. Next is administering vaginal irrigation or douche. Place the patient on a bedpan with an absorbent pad underneath. Ask the patient to lie down with a bedpan and the pad to catch any liquid. This prevents spills and keep the bed dry para ma-ensure ang comfort and hygiene. Ensure that irrigation or douche fluid was at body temperature. Run fluid through container nozzle. Warm the fluid to match body temperature and let a little flow through the nozzle to remove air bubbles. Cold or hot fluid is nakakos it discomfort, while ang air bubbles might lead to pain or improper flow. Gently separate the labia and direct the nozzle toward the sacrum, following the natural curve of the vagina. Carefully open the vaginal folds and position the nozzle to direct fluid properly. Dayang step is ma-ensure na ang fluid is nasa tamang direction for effective cleansing. Raise the fluid container 30 to 50 cm or 12 to 20 inches above the vagina. Insert the nozzle 7 to 10 cm or 3 to 4 inches and allow the solution to flow while rotating the nozzle. Lift the container to create gentle water pressure. Insert the nozzle carefully and move it slightly to distribute the solution evenly. Ang correct height allows proper fluid flow without excessive pressure, which nga-cause it discomfort or injury. Withdraw patient to remain on bedpan for a few minutes. Clean perineum with soap and water. Allow time for the solution to drain completely before washing the area. This ensures proper cleansing and ma-prevent ang irritation from leftover solution. Allow patients to remain on bedpan for a few minutes. Clean perineum with soap and water. Wait a little longer to make sure all the liquid has drained, then wipe the area again for extra cleanliness. Double cleaning ensures no residue is left behind, which can prevent infection. Help patient off bedpan, dried perineal area, return patients to a comfortable position. Carefully help the patient stand up or lay down comfortably after drying the perineal area. Drying prevents moisture buildup, which can cause irritation or infection. and making the patient comfortable improves the recovery experience. Instructed the patient who received suppository cream or tablet to remain on her back for at least 10 minutes. After giving the medication, tell the patient to stay laying down for at least 10 minutes. Staying in this position helps prevent the medicine from leaking out and ensures it gets absorbed properly. If using an applicator, wash it with soap and warm water. Rinse, air-dried, and store it for future use. If the applicator is reusable, clean it well with soap and warm water. Rinse, let it dry, and keep it in a safe place. Proper cleaning para ma-prevent sa infection and ma-ensure na ang applicator is safe gamiton sa sunod. Remove and dispose of gloves and soiled supplies. Perform hand hygiene. After finishing the procedure, take off the used gloves and throw away any dirty materials. Wash hands properly. These steps prevent the spread of germs ag ma-maintain ang cleanliness for both patient and the caregiver. Offered perineal pad when patient resume ambulation. Give the patient a perineal pad or sanitary pad before they start walking again. The pad helps maka-absorb any leftover medication or fluid, keeping the patient dry and comfortable. Ensured nurse call system was in an accessible location within the patient's reach. Make sure the patient has access to the call button in case they need help. This ensures patient safety by allowing them nga magtawag at assistant pag kailangan bulig. Raise side rails as appropriate and lower bed to the lowest position. Adjust the bed to make it safe. Put the side rails up if needed and lower the bed to prevent falls. Lowering the bed is nakaka-reduce it fall risk, while ang side rails ka-provide extra support, especially sa mga weak or dizzy patient. 30 minutes after administration, return to patient's room, perform hand hygiene and applied gloves, inspected condition of vaginal area and ask about patient's comfort. After 30 minutes, go back to check the patient. Wash hands, wear gloves, examine the vaginal area, and ask how the patient is feeling. Follow-up ensures that the medication is working properly, and kapag ang patient is wala na na-experience na discomfort, irritation, or any side effects. Use teach-back revised instruction if the patient or caregiver did not understand correctly. Ask the patient or caregiver to repeat the instruction in their own words. If they make mistake, explain again until they understand properly. This ensures the patients know how to take care of themselves after the procedure, which helps in proper healing and avoid complication. Remove drug or vaginal irrigating solution. Recorded dose, type, method of administration, and time given. Documented patient learning. After completing the procedure, remove any leftover medication or solution. Write down important details like the type of drug, how much was used, how it was given, and the time it was administered. Also check and record if the patient understood the instruction. Proper documentation helps keep track of the treatment, ensures accuracy in patient's care, and allows healthcare providers to monitor progress and make adjustment if needed. Reported to healthcare provider if symptoms did not improve or worsen. If the patient condition does not get better or become worse, inform the doctor or nurse immediately. This ensures that the patient receive proper medical attention and, if needed, a change in treatment to prevent complication.
So that's the end of our presentation.